Hello, my name is Shannon Freeman. I'm an associate professor in the School of Nursing at the University of Northern British Columbia. I'm presenting to you today from our main campus in Prince George, British Columbia, situated on the traditional territory of the Lheidli T'enneh. In our project, Predictive Modeling of Healthcare Utilization, or what we like to call POPMHU, we tried to predict how people will use the healthcare system in northern and interior British Columbia. To do this, we used advanced data science methods, specifically machine learning and computational modeling. We wanted to predict how individuals move across the continuum of care. So, for example, how someone transitions from community home care to long-term care. We aim to identify how we can use new computer tools, including machine learning and integrative modeling, with existing healthcare systems, priorities, and processes. Our team aimed to explore the best ways to engage patient partners in machine learning research and to develop capacity for machine learning work in northern and interior British Columbia. Together, our team of patient partners, researchers, trainees, decision makers, and health systems experts collaborated to use machine learning analysis techniques in new ways to answer questions of interest. We developed new communication methods, approached our research activities in new and unique ways, and created visual ways to communicate our findings in ways that are user-friendly. Our work focused on use of inter-RI data collected as part of regular clinical practice in interior and northern British Columbia. Inter-RI tools are assessments used to record clients' experiences and healthcare needs and are used across Canada and in dozens of countries worldwide. Specifically, we use the Inter-RI home care assessment and the MDS 2.0 assessment data that's collected in the long-term care setting. The POPMHU project was a joint site project involving researchers from the University of Northern British Columbia and Thompson Rivers University. Our interdisciplinary team involved patient partners, who we prefer to refer to as experts by experience, located in various areas in interior and northern BC. Our team also involved a range of trainees from various disciplines, from health science to social work, and from computer science to data science and business. Our trainees included undergraduate and graduate students, recently graduated students, and a postdoctoral fellow. Our team members share experiences using the healthcare system for ourselves, as well as in supporting others through caregiving and advocacy, and have a wide range of expertise from engineering and mathematics to nursing and education. To ensure our work was relevant to the real-world context, we started by consciously investing time to foster a shared language by development of a Team Wiki page. You can see more about our Team Wiki page at www.popmhu.ca. One challenge interdisciplinary teams often face is the use of expert or technical language and jargon. This is especially true for our project involving machine learning. This use of this technical language can create imbalance between those that understand and those that do not, and can lead to feelings of frustration and exclusion. In recognition of this, we prioritize the development of a shared language. There's two screenshots on the screen that show the terms and abbreviations page. I really liked that when establishing a shared understanding of some of these key technical terms, that we could also add hyperlinks to connect people to further resources to learn more. Use of our Team Wiki helped our team become more democratic, scientific, and efficient with our activities. When any of our team members needed to find out what something meant, they could easily look it up and determine the appropriate context and meaning it had in relation to our research activities. Our partners emphasized that having the shared language was the only way for them to understand what everyone else is talking about. This allowed our team to each feel like equal partners. Our patient partners felt that the wiki was also a very helpful tool when reading research papers. One partner noted how they pulled out the wiki to help them through, especially through the acronyms for technical terms related to machine learning. Today, we are really happy to highlight some of the outcomes of our project from the perspectives of our trainees, who will briefly share about their projects. I'm very pleased to introduce our first trainee, Robin, who's a Master's of Science in Data Science student from Thompson Rivers University.
Hello, my project is exploring machine learning with healthcare. Its goal is to apply different machine learning algorithms to predict the use of home care and long term care using data from the interior health region of British Columbia, Canada. As the project continues, there are monthly meetings with researchers and patient partners where I present, discuss, and get their reviews of the applied approaches. I learned how to apply different machine learning algorithms on real data, which helped me understand the practical approaches of these statistical methods with real world healthcare challenges. The involvement of patient partners to inform the research is indispensable. Their involvement help in correcting the applied algorithms results, declaring whether the results are promising or not. Their participation in the research gives it a decisive and experienced direction. Thank you.
Next, I'm very happy to welcome Arafat, who's also a Master's of Science in Data Science student from Thompson Rivers University.
My project is about the development of COVID-19 risk assessment decision support tool. We aim to develop a tool to assess the risk of COVID-19 for the home care clients and long-term care residents in British Columbia. It will help healthcare staff and management in prioritizing service for clients with respect to the risk of the disease. I have been involved with patient partners by taking their input and requirements after presenting my work at every stage to connecting with them on monthly basis. After considering their feedback, I have been making necessary changes to the tool. Throughout this research and project, it has been a great experience of learning new concepts related to social network analysis and epidemic modeling, as well as implementing the disease modeling of a network of people. Through continuous feedback and suggestions from patient partners helps us to go on a right path in terms of research and development of the tool.
And finally, I'm very happy to welcome Tejas, our third Master's of Science in Data Science student from Thompson Rivers University.
The patient partner's role in healthcare research has evolved from that of a passive participant in studies to that of an active partner and co-designer. By incorporating their lived experience as healthcare recipients into research design and delivery, patient views improves the efficiency and quality of research. We will involve patient partners in evaluating the data and the process we have used to generate it. Synthetically generated medical record data is desirable but challenging to create and has great potential in healthcare research. It is critical that patients are involved in the validation of this process and how the data will be used so that it is done in an ethical manner that truly benefits all the healthcare system users.
Thank you so much, Robin, Arafat, and Tejas, for sharing a little bit with everyone today about the wonderful projects that you are doing. When we met in our last meeting and had some really great conversations as a team, it was important to reflect on what this project has meant to our experts by experience or our patient partners. Engagement in our team has supported them to keep mentally active, to challenge everyone to think about different ways of approaching a problem, how to look at data differently, what are new ways to get a satisfactory answer. Together, we learned a lot about using data in many different ways, looking at things from multiple perspectives. One of our patient partners noted, we accomplished a great deal by disclosing barriers that require further work. And one of the most inspirational things is this project has taught us a lot, but it's also inspired us as a team about where are all the next steps and new opportunities that our team can go. I'm now going to welcome Dr. Piper Jackson, who's going to share a bit more in depth about the benefits of working as a cross-disciplinary team.
It takes extra work to collaborate with other groups. You need to allocate time to coordinate, translate, and communicate. But it has numerous tangible benefits. Here's some key ones. We need to be very clear when working with other groups about our ideas. This, of course, helps with communication, but it also improves our own understanding. Knowledge translation is baked into the whole process. This means that we are sincere about producing knowledge that can be used by many other groups, and we are not just doing science for the sake of it. It shifts our research focus to problems that people in the field are currently struggling with. This, in turn, encourages us to produce research results that will be more readily useful for our community members. And most importantly, a cross-disciplinary team has a wider base of knowledge than a group of specialists. This is a valuable resource that can be crucial when facing difficult choices or obstacles in our work. I'd like to talk now about two specific areas where patient-partner engagement has direct benefits for data science research. In computing, one of our main concerns is correctness. Do the things we build work properly? Do they match the real world and the needs of our users? Involving patient partners is valuable to our process right from the beginning. From the initial discussions, they can help us identify the right priorities, the areas of interest, and critical problems that are in need of research. While we're working on our experiments, they can help us to refine and correct our hypotheses and give us guidance when we encounter difficult problems. And finally, they can help us evaluate our work, check if it's ready for sharing with the public, and identify remaining gaps in our research and what the next steps should be. Finally, ethics are a key concern for all scientific research, but there is one problem that has become a big issue in recent years. For machine learning, algorithmic bias can mean that a technological innovation ultimately has a negative impact. Machine learning works by applying algorithms to analyze data and automatically generate a model that can be used to process new data, for example, to forecast or classify. However, there is a real danger of unintentionally including or even exaggerating bias that's hidden in that data. One example in the field of health is if one group of people is overrepresented in the health records we are using to build a model. Our machine learning algorithm can be biased by that group of people and make incorrect assumptions, like those people are more likely to be sick than others. But it might just be that that group has more time and resources for seeing a doctor and getting medical help. So the data doesn't necessarily represent everyone. Patient partners can be key in preventing algorithmic bias. They have an understanding of the whole system outside of just the data. They may be aware of common sources of bias, such as prejudice or disparity of access. And they may be able to recognize if the machine learning model is producing biased results.
Thank you so much for listening to our presentation today. If you're interested in learning more, please feel free to reach out to Dr. Piper Jackson or myself. And please remember, if you're interested to learn more about how we developed our shared language, please visit our team wiki page at www.popmhu.ca. We welcome any questions you may have. Thank you so much.